I recently saw a post on the social media coming from the Ghana Health Service. They will start vaccinating girls very soon. I mean, HPV vaccine. They will start giving HPV vaccine, human papillomavirus vaccine to girls. And you may be wondering why they are trying to give the vaccine to only girls. Let me explain why they are focusing their attention on girls. You see, because of how girls' reproductive system is, like female reproductive system is, when you are infected with HPV virus, the first thing or the health complication that you may experience is what? Cervical cancer. This cervix is the tube that is connecting the uterus to what? Your vagina. Because of that, more attention needs to be what? Focused on the girls, especially when it comes to vaccine. For the boys, we can also get the human papillomavirus, but the health complication is not that serious like the girls' own because of reproductive system. Because when something like cancer occur, it can affect the whole reproductive system, and in the near future, they may not be able to give birth. You will still have some question in your mind that, oh, then they should get tested before they get a vaccine. No, they shouldn't get tested before they get a vaccine, because according to WHO, even if you are exposed to the virus, because the virus have a lot of strain, different type of strain, and most common one is the HPV-16 and HPV-18. Even when you are exposed to the virus, you can still take the vaccine to protect yourself from the future occurrences or future complications. That is why WHO doesn't recommend that, oh, you should get tested before. And within the normal age range, that is 9 to 14, it's very low for somebody to be exposed to the virus. That is why they give the vaccine to them at that tender age, so that when they are being exposed to the virus in future, they can be protected. Those are the main reason why they are focusing on their attention on the girls. But for the boys, they can also get the virus and they can also get the vaccine. The virus affects both gender, not only girls. It affects both gender. Mostly, you should be between the age of 9 to 14 before you can get a vaccine. Apart from that, if you are older than that age, you want to get a vaccine, you need to consult the doctor, because there are some underlying conditions that come with the vaccine when you are older than the recommended age. The vaccine is not only for girls, but because of the cervical cancer and how female reproductive system is, that is why they are focusing their attention on the girls first. So Charlie, the boys, you go for chill. One thing about the HPV virus is you may not be showing any symptoms, but you can still transmit the virus to someone, especially unprotected sex or those who have multiple partners. So don't be looking out for symptoms like genital warts and all those sort. No, someone can have the virus inside, but will not show any symptoms and can still transmit the virus if the person have unprotected sex with someone who doesn't have the virus. So we shouldn't just focus our attention on the symptoms. We should always protect the sex, or we should reduce having multiple partners, especially the girls. As time goes on, you can get cervical cancer, and when that happens, the option you may have is surgery. And when surgery come in, you may lose your whole female reproductive system or your fertility. You may not be able to give birth in future. So please, I think we should encourage our parents to make the girls available for the vaccination, because very important for them at that particular age.